Be putting an implant here in number 21 area. Suction place. So the tooth's been out for approximately 4 months. We've got a wide-bodied implant here in number 19. So we want to stay away from that soft tissue there. All right. I like to use my straight blade and follow that up with my curved blade just to make sure we got all those small little fibers severed. This looks really good. You're going to have to suction, please. Thank you. Beautiful. All right, Woodson one, please. Select the soft tissue, a full thickness flap. And you can see here, we've got healing. And now we've got to stay away from the tooth, obviously. So what we're going to do now is go ahead and take our lance drill. Measured about 14 millimeters down to the mental nerve. All right. So one of the things I like to do is size up the buccolingual width. Here's the angle of this cuspid. This apex is going pretty good distally. So as I place this right in the center of the ridge here, at some point in time, I'm going to bump into number 22. So and voila, I'm on 22. So we're going to have to put our extension on. All right, wonderful. All right, wonderful. Now, so again, we're staying parallel here. There's the angle there. We're right in the center of the ridge. All right. Wonderful. So we're going to go ahead and put our little osteotomy drill in here. Okay. All right. Wonderful. Okay. Now, just because I know we're short of it, because I can see it on the x-ray, I'm still going to back off because I want my implant to be subcrustal. So I'm going to go with the 11 and a half instead of the 13. Okay. So now I've got our osteotomy. I've got our implant that's getting ready to go into the site. So we initially get this seated. Just need to barely turn that. And then we'll use our torque wrench to seat our implant. So we've got the implant carrier that will get seated about halfway. And then we'll go ahead and change that out to our insertion tool. Suction, please. So we'll need to to do now is just make sure we get adequate torque value, which by all intents and purposes we're getting past 35, 40, so suction. Okay. I'm going to need that back. Thank you. Okay, so now we want to be subcrestal with our placement because that's the kind of implant that we've got. And you can see here that we are subcrestal all the way around. So what we're going to do now is we're actually going to place a 3mm healing abutment, PRF membrane. We're going to put the healing abutment through that and we'll suture around that. Okay? That just looks fabulous. So now what I'm going to do while we're waiting for that is we'll go ahead and let's go straight. Thank you. I'm going to go ahead and kind of carve out where the healing abutment is going to go.
No, we can't.
Okay. Alright. Alright. So now you can see here we've got our autologous membrane here. That's going to allow us to get him to heal up better with less pain, less swelling. Now, if you'll just go ahead and put some pressure on that, please. Now, so now you've got you cut this open, and now you'll get good solid healing around that healing abutment. And we've got membrane up underneath there. So that'll work out pretty well. Beautiful. So now I've got our other way. sure this lays down like a shoelace. Alright, wonderful. Alright, so now we're just going to take and put some pressure on that. We'll get our post-op x-ray here. Liquid poor plasma and our Still Life gel on top of this. Okay. There we go. Good. Very cool. All right, good job, my friend. You did great.
Yeah, the easy part, I'm just leaving.
Thanks for letting me narrate that. Yeah, it went really, really well. So.